Let's talk Chapter 10, Drug Administration. When discussing drug administration, there's a wide array of routes that we're going to discuss today. Everything from tablets and capsules, that most common form, that PO drug route, liquids such as elixirs, emulsions, suspensions, transdermal patches where the medication is stored in the patch and placed on the skin, as well as topical medications that are placed on the skin, rubbed in, always wearing gloves. Other routes would include installations such as eye drops, eye ointments, ear drops, nose drops, and nasal sprays. You'll also see a wide array of inhalations such as metered dose inhalers, spacers, and nasogastric and gastronomy tubes as well, where we're going to need to check the tube placement, make sure the head of the bed's elevated, make sure that the drug can be crushed, meaning we never want to crush an extended release tablet and place it down a NG or gastronomy tube. Those cannot be crushed because then they're no longer delayed release. Also be things like suppositories. With rectal suppositories, we'll talk about always place the patient in Sims position. This is a position that comes up a lot in NCLEX anytime you have rectal suppositories. And we want to place the patient on the left side, just due to the way the sigmoid colon lays within the body. That way, when the medication goes in, gravity is pulling it downwards. On the left side, with their top leg bent up, that is the Sims position. It would also be vaginal medications, such as suppositories, foams, jellies, and creams, though there's no special position for that one. For parenteral medications, these are administered via injection, intradermal, subcutaneous, intramuscular. That IM is the preferred injection sites of ventrogluteal, deltoid, or vastus lateralis. When giving IM injections, you're going to hear a lot about the Z-track method. And as you can see on our diagram there, they're using the finger to pull back the skin, giving the injection. And then when they release that traction, the skin moves forward into its natural position. But that IM track is now closed off, helping to seal the medication inside. Other techniques to know with IM and injection medications. At our top, we have our three primary sites for IMs. That's going to be your deltoid on your shoulder, that ventrogluteal up in the upper buttock, upper hip, and the vastus lateralis in the side of that thigh. One thing to know about ATI NCLEX, their favorite site is going to be ventrogluteal or vastus lateralis. The reason being is that is a muscle that everyone has. You're going to see some little old ladies out there who just do not have enough deltoid muscle to give an IM injection. And that's okay. Well, everybody's got a ventrogluteal or vastus lateralis. Everybody's going to have some muscle there. Never say never, but most people are going to have some muscle there. At the same time, in normal everyday use, we need everybody dropping their pants for a ventrogluteal or vastus lateralis? No. A lot of people are going to have that enough deltoid muscle there for an IM injection. And then for our bottom diagram, we're just showing the different angles and needle lengths you would use to place the medication where you want it. There in the middle, they've got that 90-degree with the short needle, that's subcutaneous. And then to the right with that shorter needle, they've got it angled at 45 and 15 degrees for intradermal. I can tell you for intradermal, especially doing those Magnitude TB tests, it's 15 might even be too high. It really takes a fine touch to be able to do that intradermal and get that wheel for those. Takes a little bit of practice. Once you got it down, it's like riding a bike. And then on our left, we have our two longer needles showing the angles we would use for an IM injection. Just a general overview of medication administration. Safety is always going to be our top priority. We want to determine their level of consciousness, their risk for aspiration, ability to even take medications. Also obtain a thorough drug history, including drug allergies. Analyze any cues related to their injury, acute pain, decreased mobility, and also prioritize strategies to promote their adherence to the drug regimen. It's great if we can get a great care plan together, but at the same time, if that patient is not able to adhere to that plan, it's not going to do them a lot of good. Remember, we always gonna prioritize safety. Check that drug label 3 times, check that expiration date, and apply our 6 rights of medication administration. Be certain of our drug calculations, verify the dose with another RN, and avoid contact with any topical and inhalation preparations by wearing gloves. Also, discard needles and syringes in a sharps container. Be extremely careful with sharps. I know we're going to talk about this a lot in med surg as well. Of the absolute dangers. We never want to get complacent anytime there is sharps around. For the developmental needs of a pediatric patient, be aware that they get anxiety around strangers. They may regress or have increased anxiety during hospitalizations, illnesses, or even have their injury viewed as punishment. Could be afraid of the procedure, and we really need to prioritize safety. An 18-year-old has an external ear infection to be treated with eardrops. Which of the following should the nurse correctly instruct the patient in placing the angle of the ear during administration? Would that be down and back, up and out, down and forward, or up and forward? In the case of adults, we're always going to pull that ear up and out to better align the ear canal for placing the drops. In young pediatric patients, the answer would be down and out. It's just tugging slightly to align that ear canal. A nurse is planning to administer an intradermal injection to a patient. Which represents the appropriate technique for this route? That be A, a 21 gauge needle at 33 degrees, B, a 20 gauge needle at 90 degrees, C, a 23 gauge needle at 45 degrees, or D, a 26 gauge needle at 15 degrees. And that answer is going to be D, a 26 gauge needle at 15 degrees. Which statement about transdermal drugs is true? That be A, transdermal drugs are preferred because they exert only a local effect. B, transdermal drugs provide more consistent blood levels than oral and injection forms. C, for maximum effectiveness, transdermal patches should be reapplied to the same location when reapplied. Or D, for maximum effectiveness, the skin should be cleansed with soap once it's been exposed to that transdermal drug. That answer is going to be B. Transdermal drugs provide more consistent levels than oral or injection forms. And finally, the Z-track method is preferred method of administration for which drug? That be A, vitamin B12, B, iron dextrin, C, penicillin, or D, morphine. And that answer here is going to be B, iron dextrin. But anyway, that's all we got for this chapter. I'm hoping a lot of this was review for you. But again, I can't stress enough the importance of safety when we discuss medication administration, especially as we start getting deeper and deeper into all these medications. You're going to see a lot of unique considerations that we need to have on the top of our mind when giving these medications. Never forget, you are the nurse at the bedside. If you see something unsafe, you need to be aware of it. You need to speak up. But anyway, I'll see you in the next slides.